like it's all about understanding asthma. And if you have any questions, comments, you can join us in this discussion. The number to call will be on your screen. And you can also send your tweet to at CTV_Yomi or at Yomi_Otaibe. We can take up your questions and comments. Okay, now let's talk about the management of asthma. This is very important, as you've said.
Well, there are many levels of management of asthma. The first thing we do in managing asthma is to determine how severe it is. Now, broadly speaking, for the layman, asthma can be divided into two broad groups, the intermittent and the persistent. The intermittent, simply put, are those that just come on and up, and then the persistent are those that stay for some time. And within the persistent, it could either be mild, moderate, severe, or very severe. Now, how do we manage asthma? First of all, one, education. Asthmatics must be educated about the cause of disease, about their triggers, and also their caregivers who must know about it. Two, avoidance strategy. When you know your triggers, you can find strategic ways of avoiding them. The doctors can run you through those situations and tell you how to avoid them. Three, self-management. We always say that asthmatics should know how to control the asthma, and we'll teach them various things to use in order to know how to control their asthma even when the situation is getting worse. Then four, there must be a synergy between the doctor and the patient. Two of them will be co-managers of this condition. It cannot just be a unilateral role by the doctor.
And if you say the doctor now, you're talking just about the general practitioner?
Yes. A general practitioner can manage asthma, but there's a level to which he needs to refer, especially when it's a difficult asthma or if the asthma is not responding to normal therapy. When it comes to drug, there are broadly two kinds of drug. The drugs we call the relievers and the controllers. The controllers are those that prevent attack, and they're usually steroid-like drugs. And then the relievers are drugs that tend to take care of the attack when it happens. We don't encourage people to use the relievers very often if they don't have attack, because that could worsen the asthma. And as doctors say, could increase their hyper-responsiveness and make the asthma worse.
Okay, try and explain that. If a person with asthma or an asthmatic doesn't have the attack, then he shouldn't be using the reliever.
The relievers, but he should use the controllers. The controllers are the drugs that he takes often and on to reduce the inflammation and thereby deals with the mechanism that caused the attack. Also, we also say that the drug should be taken by inhalational route.
Okay, hold on. I think we have a caller. Hello?
Also, we also say that the drug should be taken by inhalational route.
Hello?
Hello?
Thank you for joining us. Please go ahead with your question or comments, and please turn down the volume of your TV set.
Hello?
We can hear you.
Hello?
Okay, I think he needs to sort out something there.
Yes. So we said that the drug should be taken in form of the inhalational route. That is, it should be by inhalers. Why? Because smaller dose produce a greater effect. Two, it goes directly to the airways. And three, you do not have all the side effects. We say avoid oral drugs by all means, because they go to the GIT and they don't go directly to the oral route, and they have a lot of side effects.
What are the side effects?
Yeah, the side effects are that the patient could have shaking of the hands, it could have the heartbeat could be faster, and sometimes can also have affect some of the the elements in the body, like the potassium. But the most big effect it does is that it causes tremors and it can lead to palpitation. And also, it will not even get the right dose to the airways. Then the other way we manage is that we should also advise them to use what they call a peak flow meter. A peak flow meter is a simple instrument that every asthmatic should have. I've always told people that just as this sphygmomanometer is useful for everyone that has hypertension to measure his asthma, measure his blood pressure. So everyone that has asthma needs a peak flow meter to measure his his asthma. Then they must also know when the asthma is getting worse. That is, as I mentioned before, the they're having more night attacks, they're waking up more nights in the week, they are getting more wheezy, their drugs are not getting functional, and they are exposed to newer environment that cause asthma. Let me give you a simple example. There's a patient we admitted some time ago, and this patient was not doing well. In spite of all the measures we are taking, all the drugs we are giving, at one point, the patient told me that I feel the hospital environment is causing this difficult problem, and he wants to be admitted in a nearby hotel, and he comes to see us. He kept on agitating. Then I gave him the opportunity to go and come back and see us the next day. Over 2 or 3 days, he was coming to see us, and he was getting well. We now late recognized that the hospital was being repented, and that patient was reacting to the pains in the hospital. These are what we call occupational sensitizers.
Okay.
So
let's see if the caller is back now. Hello.
Hello?
Thank you for joining us. Please go ahead with your question or comment.
Hello?
Hello, we can hear you. Please go ahead.
Hello? Hello, good afternoon.
Mohammed, good afternoon. Go ahead, please.
Yeah, my name is Mohammed Mohammed. I want to find out this. I want to ask the doctor if my son is asthmatic. I can't hear you well.
Go ahead, Mohammed. Go ahead.
I can't hear you.
Go ahead. You. Okay, I think it's gone. Mohammed is gone.
So I found out that there are other things that I will not know. So when you find out the asthma is not getting controlled, look outside the environment. That there may be other things that are not helping the drugs to get controlled. Or there may be a heightened emotion. The patient may be going through a stressful situation in life. But you see, there are other people who believe that there are other things that can help take care of asthma apart from the drugs. They believe that they can use some non-drug things, but I think most of them has not been proved. Some will say they can use acupuncture, some will say they can use yoga, some say they can use herbs. I would like to say that if a thing has not been universally authenticated or universally accepted, you should try to minimize its use, and if possible, discuss the health practitioner who will look at the literature and see whether these things are viable. But I would say that a positive outlook to your disease is important. If you have asthma, the fact that you must have optimism. Don't begin to have a sick person effect, to believe that, well, I'm so bad, I'm not doing well. Just keep being positive about your health. Keep believing that you can be better. Keep to your medications, and you can do well.
Now, this week, the national guidelines for the management of asthma was unveiled. Tell us about this, because I was thinking we already have a way where we manage asthma. Why this guideline again?
Yeah, you see, guidelines are what is prescribed universally for the management of diseases. But apart from the universal prescription of guidelines, you have to localize or situate guidelines to the local environment, because diseases have different ways of manifesting. We always say that asthma has different phenotypes, different genotypes, and different endotypes. So the types of asthma we find in the African type may not be the same we find in the Europeans. So we need to situate guidelines within our own environmental condition.
So give us briefly what this guideline.
So the Nigerian Thoracic Society for about 2 years now have been looking at the worldwide literature and studied all the various work that have been done in asthma in this country. And we have produced a document for the management of asthma in Nigeria. And this document covers asthma in pregnancy, covers occupational asthma, covers asthma in children, covers difficult asthma, covers severe asthma, and covers chronic asthma. So with this guideline, doctors now know what they can use to manage asthma. But I also want to say that guidelines are not necessarily built cast in stone. It does not disturb the doctor from using his initiative. These guidelines will be widely available in all the hospitals, all the physicians, all the medical schools, so that they can have it.
Okay, and finally, is asthma curable?
Yes, you see, doctors don't like to use the word cure. We like to say that asthma can be managed, and you can live well and a good quality of life even though you have asthma.
Thank you so much for coming on today on the show.
Thank you very much.
And thank you all for watching at home. It's been talks around understanding asthma. And if you or someone around you is having all of these issues, I think this is the best time to seek medical help. Thank you for watching once more. I'm Yomi Otaibu.